How CapMinds customizes OpenEMR for every specialty. Hi, in this video, we're going to show you how CapMinds transforms OpenEMR into a tailored solution for every specialty, solving real pain points that clinics struggle with every day. OpenEMR is powerful and flexible, but out of the box, it's built for general medicine. Specialty practices, whether mental health, dental, pediatrics, dermatology, obstetrics, or cardiology, often hit friction when trying to use it for their workflows. Templates don't match specialty needs. For example, behavioral health clinicians need DAP, BIRP, or mental status exam templates. But OpenEMR delivers generic SOAP forms by default. Dentists need odontograms, intraoral imaging, tooth numbering systems. Pediatricians need growth charts and immunization trackers. Without proper templates, clinicians waste time customizing every note. Specialty billing and code sets. Each specialty uses its own code sets: CDT for dentistry, CPT/DSM for psychiatry, and immunization codes for pediatrics. OpenEMR's billing engine isn't pre-tuned for these. Claims get rejected or coded incorrectly if the system isn't configured properly. Role-based access and privacy. In mental health, especially, confidentiality is critical. Certain notes must be locked from non-therapist staff. Dental practices have roles like dentist, hygienist, assistant, and front desk with different data access. OpenEMR's default ACLs often fall short unless heavily customized. Scheduling and group workflows. Mental health practices run group therapies. OpenEMR's calendar is built for one-on-one appointments, making group sessions clumsy to manage. Dental clinics require multi-chair scheduling, recall workflows, and provider-level coloring. Pediatricians need reminders for vaccines and multi-visit flows. Weak outcome measurement and reporting. Specialty practices want to analyze trends, therapy outcomes, no-show rates, and growth curve deviations. OpenEMR's built-in reports lean toward visit counts and billing, not specialty metrics. You end up exporting raw data and building custom SQL reports. So, how does CapMinds solve these? We take OpenEMR's open architecture and extend, configure, and integrate so your EMR feels native to your specialty, not a compromise. Specialty-specific templates and forms. We build layout-based forms and modules for your specialty, e.g., odontograms and CDT forms for dentistry, mental status and treatment plan forms for psychiatry, growth charts and vaccine flows for pediatrics. We embed scoring engines so the scores auto-populate and track over time. Billing and code set integration. CapMinds imports or maps specialty code sets, CDT for dental, DSM/CPT for behavioral health, and immunization codes for pediatrics. We tie forms to billing so that when you complete an encounter, appropriate codes and fees auto-populate, reducing errors and administrative burden. Role and privacy controls. We configure fine-grained ACLs and role groups. Therapists see mental health notes, assistants see charts, but not private therapy logs. We integrate audit trails, two-factor authentication, and ensure only authorized roles can view sensitive segments. Optimize scheduling and workflow. CapMinds enhances scheduling so that group therapy, recall lists, chair assignments, and multi-visit flows function smoothly. We build automated reminders triggered by vaccine due dates, therapy follow-ups, or recall windows, reports, and analytics. We develop dashboards tailored to your specialty, therapy outcome trends, no-show analytics, growth percentiles, and procedure productivity. We also build custom SQL or BI connectors so you can slice, dice, and visualize your practice data. If your specialty practice is wrestling with form mismatches, coding errors, scheduling awkwardness, or weak reporting, CapMinds can make OpenEMR your tool, not a compromise. Reach out and let's discuss customizing OpenEMR for your specialty.